In this lecture, we're going to be talking about travel medical insurance. So everything that you would need to know before visiting the United States. We've talked about insurance before. We have insurance for many different things in America to protect us, protection from needing to pay all at once if you have medical bills in this case. If you are injured, if something bad happens to you, you are hurt and you need to go to the doctor or to the hospital while you are traveling, you need to get insurance to give you coverage for your medical bills, to pay for the costs to go to the doctor. The first thing that you need to know is that the U.S. medical costs are very expensive. That means they are very high in cost. Even Americans cannot afford to pay for the medical costs. Let's read here together. It says North America, that's including Canada and the United States, North America has the most expensive medical care in the world. It can cost you hundreds of dollars for a few stitches and a prescription for some antibiotics. Stitches are just when you get a cut and then you have to go to the doctor for him to sew it or close it up. Those are your stitches. Just to get a few stitches, it can cost hundreds of dollars. And also, if you need a prescription for some antibiotics. We talked about before prescription drugs versus over-the-counter drugs. If you need to get a prescription, you have to go to the doctor. And just to visit the doctor to get that prescription, say that you have a bacterial infection. After you got the cut, there was bacteria or bad germs that got inside of the cut, and it maybe has a white color to it. It's infected. Then you would need antibiotics to kill the bacteria and to get healed. Well, you would need to get a prescription for those antibiotics. And again, that can cost hundreds of dollars to get the prescription from the doctor in order to be able to get your antibiotics. An overnight stay in the hospital can cost thousands of dollars. That's why many times when patients go into the hospital for surgery, something in the body needs to be cut open, surgery, they will actually do it as an outpatient. This means that they will only have you in the hospital for a few hours for an outpatient surgery. They will not keep you overnight because if you stay overnight in the hospital, the price is very expensive. And to save on costs, they push people out of the hospital as quickly as possible. So staying over the night in the hospital is not a normal thing unless it's very necessary because it's very expensive. Free medical care? The U.S. healthcare system is not free healthcare, not for visitors, and not for citizens of the U.S. So even for all of us living here who were born here, who are citizens of the U.S., healthcare is not free, and it's not free for anyone. I know in many countries in Europe and elsewhere, there is a system of taxes that pays for the citizens' health care. In the United States, this is not the case. Everybody must pay for their own health care. Foreign visitors without travel insurance will have to pay out of pocket for their medical treatment. If you're paying out of your pocket, means that you have to put your hand in your pocket, get your money out, and pay. You have to pay yourself is what it means. So if you're visiting the U.S. and you do not have any insurance, you will have to pay yourself somehow. Usually, if you do not have all the money up front, then they will make a payment plan for you. Each month, you will pay a little bit for however many years it takes to complete paying it. Medical treatment, it says. Just want to make sure you know what treatment means. To treat someone means that you care for them. So if you're giving medical treatment, you are providing medical care. Whatever that you're doing to help that person get better is your medical treatment. Emergency room visits. If you have a medical emergency, the hospital will expect payment for all treatment costs. An emergency room is the part of the hospital you go to when you are in need of urgent, fast, quick care. You need to see a doctor right away. You cannot wait. You go to the emergency room. You are expected to pay for all costs, even if it's an emergency, not a regular doctor visit. This includes, the first point here says surgery. Like I mentioned before, surgery is when they need to cut you open to fix something. Medicine are the drugs or the pills that you would take. Anything that you put in your body or on your body to help you get better is a medicine. Ambulance transportation. The ambulance is the vehicle, the car that comes and picks you up to take you to the emergency room. It is the emergency transportation, the ambulance. And other treatment costs are medical supplies. Any of the things that they need to use to help you to get better are the medical supplies. So you're expected to pay for any medical supplies you use, the ambulance that you took to the hospital, any medicine that you need, and if you would need surgery, you have to pay for it all yourself. None of these things are free. Students and temporary workers. Let's read about students first. If you are a foreign student studying in the U.S., you will need to get medical insurance through your university, and you will need to pay for this yourself. So each university, if you're a foreign student, they will give you an insurance plan that you will need to pay for. The insurance will be through the university, and they should give you all the paperwork necessary to sign up for the insurance. These universities will require, they say you must get this medical insurance that we provide in order to study here with us. So you will be required to do this. On the other side, it talks about temporary workers. Temporary means just a short time. Short term, not for a long time. So if you are coming to America to work just for a short time as a temporary worker, you will need to get medical insurance through your employer. Businesses will provide medical insurance that you pay for through their business. So the same thing would happen if you're coming as a temporary worker. You would need to ask your employer to give you paperwork that you can fill out so that you can get medical insurance while you're working there to protect you from any injuries that may happen, not just on the job, but while you're living in America. An evacuation may be necessary. There's a picture here of a helicopter because an evacuation is when you need to be quickly transported from whatever place you're in to a different hospital, maybe that's further away. So in your case, since you are not a citizen of America, and you are a foreigner, you may want to be evacuated or taken to your home country for medical care. So let's read here. Emergency medical evacuations are usually not covered by U.S. health insurance plans. So if you buy medical insurance while you're in the U.S., they will not pay for you to be able to fly back to your country if you're sick. You would need to buy a separate medical evacuation insurance plan in order to pay for that. If you have, say, through your employer or through your university medical insurance, those will just pay for you to be treated in that area that you're living in right there. So probably at one of the local hospitals, it will pay for you to be treated or cared for at that location. Pre-existing conditions. It is possible that a travel insurance provider can deny your insurance claim due to a pre-existing medical condition. Pre just means before. If something is existing, it is with us, it is alive, it is there. So if it's pre-existing, you have a medical problem, something wrong with you that you've had for many years. Say, for example, you many years ago were in a car accident and you hurt your back and you're constantly having problems with your back. For 10 years, 15 years, your back is sore. You cannot get your travel insurance while you're in the U.S. and say that you want to have treatment for your back or back surgery because it was a pre-existing, it was already there a long time before, a pre-existing condition. They can deny or say, no, we are not going to pay for that. Many times they will not. They will pay for things that happen during the time that you've been paying for the insurance. So if you come to your university, you get their medical insurance, and you're riding in a taxi and it is in a car accident, and you hurt your back then while you are going to that university, then it is not pre-existing. It happened during that time, and your insurance would cover a condition like this. Let's read on the right side here. In some cases, the condition is one that the traveler didn't even recognize as a medical condition that could disqualify their coverage. So this is where it gets very tricky, very difficult to understand, even for those of us who English is our first language. Insurance can be tricky because the providers of the insurance, of course, they do not want to pay if they do not need to. So they try to find ways to not pay for any insurance claims that you may make. For example, say that you had some kind of medical condition from your childhood. Maybe something that was dormant. It was not causing you problems. Maybe you had asthma, where you cannot breathe properly, but it never really bothered you because you didn't do a lot of physical activity. Now maybe you're doing a lot of physical activity and the asthma, your breathing, is giving you problems. Well, you've had this medical condition for many years. It just didn't bother you. Now that you are more active, you would like to do something to help you be able to continue to be active. They may disqualify you for coverage because it is a pre-existing condition, even though it was not something that was a problem for you before. They will still say, well, you've still had it all of these years, so we will not treat you now.